Navigating the health and social care system can feel challenging at the best of times. If you're in a mental health crisis, this challenge is considerably amplified. If you're a non-mental health professional trying to support this group of people, the work can feel really daunting. So we've made a series of films of 4 different mental health crises. Each of the films takes the patient from the home to the emergency department to demonstrate the clinical pathway. They are not meant to be perfect pathways or perfect interactions. They are designed to create food for thought about what it might be like to be the patient or the carer. The films are about 20 minutes long and have been designed to be used in a variety of settings, from the classroom to the individual learner in front of a computer. We've posed a number of questions and issues to help you think about the case, which means the session will take about 90 minutes.
So we often see patients with depression, anxiety, and anxiety can often be a really strong feature of someone's respiratory condition. As you can imagine, becoming breathless is a really frightening experience. So we know some estimates are up to around 68% of patients with a respiratory condition who will experience anxiety and significant panic.
Obviously they're all. Just like to come in.
Yeah, no problem. Where are we going?
Just straight down.
Who's it you come to see?
Yeah,
Your mum.
yeah, straight down.
Hello there. Hiya, I'm Ben. This is Tom from the ambulance service.
Hello.
Ambulance, me.
And what's been going on? I can see you're struggling a little bit for breath there.
Just have shortness of breath.
Shortness of breath. Okay, okay. Has it been going on for some time?
Yes. 3 years.
For 3 years. Okay, okay. With quite a few hospital attendances, I'd imagine.
She's got released 4 days back.
4 days.
Yeah.
Okay. Have you kept in for a little while?
Yeah. I was in for four
For 4 days. Okay. So that was a course of antibiotics. IV antibiotics.
Yes.
Yeah. Okay.
Just take your hand. I'm just going to pop this on your finger, all right, while we're talking.
Tom's just going to do a few checks on you.
Rest that there.
Okay, so just try and relax for us. Just okay.
But I'm fine.
You're fine. Okay, that's good.
No hospital.
Okay.
It's a leg surgery, me.
So this particular episode, did it just come on quite quickly, or has it been building up? Quite quickly. Okay.
Your blood pressure. Yeah?
And have you got any pain at all?
Just.
You got pain there across your chest, have you? Does it feel quite tight? Feels quite tight. Okay.
I'll be.
Okay.
Okay.
Have you been coughing? Yeah. And is it a chronic problem that you've got? Is it a long problem, long-standing COPD?
Just relax.
COPD.
the arms.
Okay.
Quite
Okay.
like wheezy and we're having it ongoing now. Like,
Okay. Does this feel any different to your normal breathing?
It's. I just get.
It just feels like you can't get enough breath in. Okay. Okay. Have you been coughing up much? Are you coughing up much?
Yeah.
Is it sort of, what colour is it?
Wait.
White sputum. Okay. No blood in the sputum. No. Okay. Okay. Tom's just going to carry on doing some more checks. And your oxygen levels are okay as well.
So I don't. No hospital.
Well, we're just going to have just carry on doing a few more checks. I'd quite like to have a listen to your chest as well. Okay.
obviously leg surgeon.
Dr. Benito hospital.
नहीं अब बस relax होना तो.
So just have a little listen front and back. Okay, so I can do it over your lovely dress. That's it. In and out through your mouth. That's lovely. That's great.
That's it. Nice and slow with that breathing. That's it.
Okay, so no particular wheeze there, so I don't think you need any nebulisers at the moment. You're probably quite used to having a nebuliser, aren't you? How do you feel about going to hospital?
No.
I mean, whatever you recommend is the best thing to do. I mean,
No.
if you think she needs to go to hospital, we take her to hospital.
हॉस्पिटल नहीं जाना है मुझे नहीं जाना है मुझे आई एम फाइन डॉक्टर पे नहीं जाना है मुझे अब काम पे जाना यू गो टू वर्क वेस्ट
Don't worry about it.
Okay.
I've told her I'm going to come with her. If you think it's best, I'll come with her.
Yeah.
Because I've taken her
Work,
from work
office.
anyway.
Okay, well,
Don't worry about
I
work
think on reflection, you seem quite anxious and your breathing's quite raised at the moment. You're getting quite tired. So I think it'd be quite a good idea if we just get you up to the hospital, just for a few further checks. Probably won't have to keep you in. Well, we hope we wouldn't have to be kept in this time because you don't have any wheeze. So hopefully we can just get you up there, get you seen, and then get you home.
for few hours.
Yeah, it's often best to be seen early on when something's going on. Okay, so it's probably a good idea.
Yeah.
All right.
Yeah, I'll go and get a chair for us and we can carry you out.
बस रिलैक्स हो जाएंगे मैं साथ दूंगा बचाएंगे थोड़ी देर
Hello, Mr. Devani. My name is Dr. Amin. Sorry to have kept you waiting. Hello. How are you getting on?
Not too well.
I've had a look through your history, and I've had a look at the X-ray that we've done and the blood results, and everything is fine. And there's no reason for you to be in hospital. So I'm very keen to send you home with some medications. How do you feel about that?
Yeah, hospital. I don't want to go. Yes, I remember I was there 4 days ago, and I was in the same room as this other person I made friend with. She had COPD. What I have right now. And I heard these all noises, nurses, doctors, everybody running, so much of noises, and then she passed away.
Relax.
You're feeling very anxious.
She died.
I understand that must have been very difficult for you. But
I don't want hospital.
that's not gonna happen to you. Okay.
She's perfectly fine.
I'm just gonna have a quick listen to your chest whilst you're here. Deep breath in and out. Okay. Your chest sounds okay. All right. Have you ever had panic attacks or any anxiety in the past? Okay.
I have it.
Before we send you home, I'm quite keen to get liaison psychiatry to come and review you. Then,
Am I going mad?
no, it's not to do with that.
I'm not mad. पागल नहीं हूँ मैं.
They liaise very well with us, and they'll be able to understand any sort of detailed issues about concerns that you may have regarding your condition, and give you a bit more support. That's all it is.
Is that what you recommend?
I do.
Best thing to do, yeah?
Yeah.
Okay.
Yeah. क्या बोलते हो? ठीक है? पागल तो नहीं हुए मैं?
It's you're not going mad. It's just to understand it a bit
Is that
better.
something common, doctor?
It is, yeah.
Yeah. She's just obviously getting a bit scared, thinking it's something to do with mental health.
Just getting
I mean, but
breathless.
I think, given that you're breathing very quickly, it's a common sign of anxiety, and it would be wise to get them to come and have a chat with you just to get a better idea of what's going on. All right. Good.
Every time we got fuel, yeah, we breathe them out, don't we?
Hello, so Mr. Stevani, my name's Dr. Ashby. I'm one of the consultant liaison psychiatrists. I'm guessing, are you a relative?
Yeah, I'm a son.
Nice to meet you. The reason I've been asked to see you is that often physical illnesses can be connected with mental health difficulties such as depression or anxiety. And actually, if we look at both together, sometimes that can help us to treat both of them. So we can often know that breathlessness and anxiety are connected.
I'm not going to leave it.
It's not talking about that at all. We very often, my only job is to work in the hospital, and we quite often see people to look at the whole of what's happening to them and look at how we might be able to help. And we know that your mind is absolutely connected to your body, so people often talk about having butterflies in their stomach when they feel anxious.
So this is quite common then?
Yeah, it happens to all of us. So
see, that's a big thing. That's I've been told, the previous doctor was saying that's quite common, so I'm just trying to explain that.
Yeah, really.
Also, because I just want to know how serious, if there's any medication, anything else needed. Because I've actually booked myself. I was meant to be going on holiday tomorrow. Yeah. But that's why I've come spent some of the hours today. So is that something I'm looking to cancel? But is that something I should?
Is there anybody else in the family who's around who could help out? Any siblings or anything?
Could probably get hold of.
I'll be fine.
Yeah.
We go on holiday.
Yeah. And I think what else we could do, we could get your GP involved, so get your GP appointment. And also what I'd like to do is book you an appointment with one of the respiratory psychologists so that you can talk about further techniques. So, you know, the breathing and the positive imagery, the thinking of a happy place that I just talked about. They could do more things like that with you, but in a clinic, not to come into hospital to do that.
Good, man.
Yeah, well,
how would that feel?
Huh?
Yeah.
Okay, great.
We'd like to do the referral.
Fantastic. Let's get you home.
Okay then. Thank you.
Thank you.
Let's take a look at what happened to Taru by connecting her thoughts to her physical symptoms and seeing how quickly this escalated. She experiences a physical symptom. She then had a distressing thought. Her muscles tensed up and her breathing became more shallow. This became more frightening. Her heart started racing, her breathing quickened. She started to feel dizzy and lightheaded. Then she was terrified. She engaged in a safety behaviour. The symptoms started to subside. The safety behaviour was reinforced. The key to managing anxiety is to break this cycle. The intervention can happen at multiple points in the cycle, and we can target the physical symptoms, or the thoughts, or both. So let's go back to the house and see how a paramedic can break the cycle with Taru in that setting.
I think what we've established is there's nothing too much acute going on, okay? I don't think there's an infection going on, okay? We haven't got a temperature. All your observations are in the right sort of ranges that we'd be happy with, okay? So I think what's really going on is that you've come out of hospital and the feelings of anxiety have stayed with you. What do you understand about anxiety and breathlessness?
I get this very tight.
Yeah.
Chest, and I get nausea in my stomach.
Yeah.
And this gets...
They're all quite common symptoms with anxiety, and
I don't like hospital.
Okay, I mean it's quite common to be feeling this way. You come out of hospital.
But she's just getting anxious.
Yeah.
Over these things.
Yeah, absolutely. I'd really like to try something here at home now. If you're okay with that. Okay, we can try some relaxation and breathing techniques. Okay, we can try and get on top of that for you. If we just get a quick scale of how your anxiety is at the moment. Is it a 0 is it no anxiety, or is it 10? Is it very anxious? Okay, I think we can sort of see it's very high. Okay, so what I'd like to quite try with you now is something you can try on your own here. You could do this absolutely on your own. Okay, what we can do, so if we can just try and do a quick breathing technique where we literally hold our breath and then breathe out for 4, and we can purse our lips. Okay, that's very good, Then breathe in through your nose For 5, 3, 4, 5, and then out through your mouth again. Okay, and I can see you're fighting that. Okay, you've got very tense in the shoulders. These muscles really go for it when you're getting like this. Okay, so you can help as well. Okay, there's a good technique. We literally just drop down onto our knees, flop down. Really relax those shoulders. Okay, so in through the nose and then out through the mouth for longer. That's really good. Okay, now this isn't something that is just not going to, this isn't just going to happen. This isn't just going to be a miracle cure, but it's something we can work on. Okay.
I don't have to go to the hospital.
Well, we've established you probably don't need to go today. But what we quite like to do is to get your GP on the phone. Okay, we'll call them up.
Holiday.
Relax.
Yeah, we'll call the GP. We'll explain to them what's gone on today, and the experience and the symptoms you're feeling. Okay, we're quite happy that it's anxiety related, and we'll feed that back to the GP. We'll tell the doctor your son's going away for a few days. Okay. So could you just give us a score now? How's your anxiety now? What level is it now?
0 sentence which
Say 4.
Okay, so it has reduced. You can do this whenever the feelings do flare up. Okay?
Yes.
All right.
Thanks.
Thank you. Yes. Thank you.
There are a number of really useful relaxation techniques, and it's worth having a few in your toolbox because different people respond in different ways. The most basic one is to take a deep breath in through your mouth to a count of 3, and then to breathe out slowly to a count of 4. A variation on this is after you've taken your deep breath in, hold for 10 seconds, tensing every single muscle in your body from your forehead to your toes, and then to breathe out slowly to a count of 4. The added benefit of these methods is that they provide distraction from the negative fear-based thoughts, but you can also ask the patient to think of a pleasant memory.